Our webinar is entitled Employer Strategies for the Affordable Care Act. Presenting today will be Doug Johnson, who's the president and founder of JA Benefits. JA Benefits is a full-service employee benefits brokerage and consulting firm, and Doug has expertise in all areas of the employee benefits field. In addition, we have Chris Schrader, who is the president of Schrader & Associates, a full-service human resources practice. Chris has more than 27 years of experience and has held executive-level roles in operations, sales, finance, and accounting, as well as human resources. We hope that you'll find this information both thought-provoking and compelling today, and we're going to start off with Chris Schrader talking to you a little bit about the human resources perspective.
Good. Thank you very much, Greg. The presentation today will really be divided between Doug and I. I'm going to focus on the front end on what I regard, from my standpoint and study on the issue up to this time, is some of the big implications for businesses, especially the strategic design of not only benefit plans, but also having to deal with the entire rewards for work model for employees. And then Doug will follow with, I'm sure, what so many of people are interested in, a lot of questions around the actual compliance features. I'd like to go ahead and start the presentation at this point. Bear with me just a moment. Okay. We are going to talk, as I said, about the small issues. The implications for organizational structures, I think, come from three key directions right now. First off is the 50 FTE, or full-time equivalent employee threshold for the pay or play portion of the plan. The 30-hour threshold for health plan eligibility, meaning the number of hours that an individual must work in order to be eligible for coverage at a company's plan. And then, most importantly, the federal subsidy for those opting for the exchange plans. So let's first address pay or play. I think one of the key things that organizations are going to have to address, in particular those who are near this 50 FTE threshold, will be, can you get the work done with less than 50 FTEs? I am confident, those on the phone who are in human resources, I am confident you can expect questions from the C-suite, especially questions from the finance department, as to whether or not this is possible. The main reason being, of course, is that if you can stay below the 50 FTE issue, that provides you with the greatest operating room for your benefits with the least amount of government direction or intrusion into your business with regards to those benefits. And I think that's going to be critical. If you can go below that 50 FTE, can you deploy existing staff? This is going to be critical, because if the answer to that is no, then you're basically going to have to work out a strategy and implement a tactical plan within the next year to arrive at a point where you can, if not deploy existing staff, then you have to figure out where your supply is going to come from for the type of talent that you need in order to gain the leverage necessary to work below 50 FTE, or you're going to have to carry out internal development of existing staff to fill those roles. I think for very few companies will it be possible simply to cut or attrite your way to 50 FTE and just move along as you work. It is entirely possible that some companies near that size will indeed have a level of staff that perhaps they let get out ahead of what they could actually profitably deploy. But that's going to be very few companies. The economy of the last 4 years and the challenges that have come with it, I think, have put most companies in a position where they have winnowed that staff down. So for those of you in HR, if indeed it is an objective of the company to stay below that 50 FTE threshold as an objective, as a competitive objective, then it's going to fall to you to figure out how that can happen. I think another clear implication of the 50 FTE rule will be that of the use of contingent labor in workforces. There are very few workforce models today, certainly some, and some that are very established, especially those in seasonal businesses, that are extraordinarily experienced and skilled in dealing with ebbs and flows of workforces and having a substantial portion of the workforce be contingent. However, I think it's safe to say that most businesses today do think of themselves in terms of using full-time employees, whether it be because they don't want the management challenge that comes with not having full-time employees, or they feel they gain the most leverage with full-time employees, or a whole host of reasons why it makes perfect sense in today's construct to have 50 full-time employees. But the key issue there is employees, and this is where I make the question, do you really need to, quote-unquote, own all of your employees, and would it be possible to have a workforce mix that had a group of workers that of course, provided services and value to your organization that were nonetheless employed by somebody else, a temporary agency or a PEO, something along those lines. So I think this is another question that is going to be begged, and that I advise people to work through their answers to it. Another thing that comes up, and I've heard this quite a bit as I move along, and I'll address this, and Doug will too later in the presentation, but there has been a fair amount of talk, and I regard it pretty much as talk, because obviously nobody's had to make a decision yet, that it will simply be a straightforward thing. We'll just get rid of our health plans. We'll pay the $2,000 penalty if we're a 50-plus person company, and that's going to be cheaper than our health plan anyway, and I won't have to have all these benefits professionals on my staff, and that will be a far cleaner world. Well, I think it's a lot more complicated than that, and certainly Doug will speak to the issues dealing with the law around that, but my question is a far more basic one from a human resources point, and that is, can you really attract and retain the desired human capital without a health plan? And I think this is my answer to that question is, quite frankly, I think you may have a hard time, but with different groups. There will be a difference, I think, in the true groups for this. But I think certainly in early going, businesses will have a hard time just jettisoning their health plan, certainly within the first handful of years of the act. Let's next deal with the 30-hour threshold. And of course, this has to do with eligibility. And so the next question that will come, and again, this will probably come from finance, and perfectly reasonable that it be so, is it feasible for us to cut back to 30 hours for some or many of the staff? Now, I think the quick answer to that for many workforces will be, well, we barely have enough employees as it is. We haven't been able to hire, or we've had hiring freezes, or we've been careful about hiring, and I can't possibly see any way that we could get the business done with if we cut the hours back to 30 hours. But I'll tell you, I think this is something that's going to get a harder look, because we've never quite had the pressure or the impetus that comes with the sheer enormity that is the Affordable Care Act before. And so my point is, we may think about this differently against that backdrop than we have in the past. But again, this is going to be material, because remember, if the workers do not put in more than 30 hours a week on the job, then they're not eligible for the plans. And again, that cuts directly into, of course, your count, because with a 50 FTE, of course, FTE stands for full-time equivalent. And so obviously, if you think to yourself, well, I'll just go to a ton of part-timers and that will be it, well, no, that probably won't work. But they're going to look at the number of hours worked by those people and see if that comes up to 50 FTE. Next question, may it be advantageous to have more workers working fewer hours? Is there a way to cut it that way and, again, move the workforce around in such a way so that the exposure to the act is mitigated? And so that's another question that I think is going to be begged. And another one, and this happens every single time. We have seen this across the globe, but in particular in the United States. We've seen several iterations of this in the last 30, 40 years. Anytime costs get significantly out of whack, it is inevitable that corporations, businesses, organizations of all types, for-profit, not-for-profit, it simply doesn't matter. Every single one of them, when faced with an increase in cost in human capital, puts pretty significant energy into leveraging technology differently. And if all you, to me, one of the starkest examples is what happened to the U.S. steel industry in the last 30 plus years. U.S. steel output before the recession was equal to any year's high mark prior to that, done with a minor fraction of the laborers needed to put out that steel. The technology changed extraordinarily rapidly. The companies became smaller. Their equipment and the technology they leveraged was just completely unheard of course, in the 30s, 40s, and 50s, and to the point now where you have plenty of steel and very few workers. And so this is another one that I expect is going to have to come up. And again, there's going to be big implications here for HR practitioners. The next thing that comes up is, of course, federal subsidies for exchange participants. And the call out here that I think is simply not being emphasized enough from my point of view is the new incentives that are coming into play from the tax code side that really have never been present and had an impact on the workforce quite the way these will. And the call out is that employees making $30K or less per year at a household level, not individual level, a household level, will be massively subsidized in the act. And that those subsidies then substantially erode at the 70K level. I believe, therefore, the call out here for me is that I believe a bifurcation in labor distribution is coming. Now, I'm not saying it's going to be here on January 1, 2014. I don't believe that. But I believe big pieces have been set into motion here that set this up, and there's not going to be a whole lot we're going to do to fundamentally arrest that. And what you see here is a chart that illustrates it. This chart was prepared by David Gamage. It's part of a larger scholarly paper that he did that was released a couple of weeks ago. And he prepared the paper while on leave from University of California, Berkeley School of Law, where he had left there to do a fellowship with the U.S. Treasury Department in its tax policy unit. So it was in that role that he wrote this study. And as a matter of fact, anyone on this webinar who wants to send me an email, and you'll have my contact information at the end of this presentation, I'll be happy to send you a link to the report. Fair warning, it is 42 pages long and tons of footnotes, but I've pulled out here what I believe is the chart that best illustrates a point of view here that I think that needs to be considered. When you look at the family of four household as an income percentage of FPL, so you're seeing it runs from 100% down to 250. In the yellow shaded area, I have, Dr. Gamage has shown, and I've illustrated here, the stark net benefits in exchange of coverage that are going to be present in the plan, in the design, for the low-income workers. So to the point, if you look at, let's just pick a $30,000 household. So let's say we've got a household that's got one employee working for you full-time and a spouse that works part-time. And so they've only got a $30,000 annual household income. If they do not take the plan that you have available for them, and that plan does not meet the minimum qualification for affordability, then they can go into the exchange and get subsidization to the tune of $13,763. Now this is shown out. I don't have it here. I'm sorry. I meant to put it in one of the text boxes. This shows the subsidies out to 2016. So these will not be the subsidies present on January 1 of 2014. Remember, the plan goes into effect on January 1, 2013. Subsidies began in 2014. But nonetheless, you can see what's happening here. Fundamentally, the value proposition, I believe, will change in a major way for workers in the income levels, household income levels you see shaded in yellow and green. Where, perversely enough, if they go to work and work for a company that does indeed offer a minimum affordability plan, if that employer does that, whether that employee takes that plan or not, the sheer availability of the plan makes them ineligible for the subsidies. Therefore, it will be in the compelling economic interest of workers with incomes at these household earning levels you see to go to work for employers that do not have a minimum affordability plan present in their plan array. Now, I'll grant you, this is the exact opposite of what the federal government wanted to happen, right? Doug will speak in far greater detail to the penalties involved, but the government did not want this to happen, and so they put into place countervailing penalties. What I believe, and Dr. Gamich has discovered, is that they did not pay sufficient attention to the tax code, and so they have created these perverse incentives. Therefore, it's my belief that on a company-by-company basis, this will not be true for everyone because you have to take into account the type of human capital you have, where that talent comes from, what that talent needs. But I think what this table clearly illustrates is that for the people at the higher end of the household earning situation, you can see that their subsidies are very, very narrow, very small, and utterly erode at the $84,000 household income level. Now, let's face it, if you've got two 40-plus thousand a year wage earners in the household, well, then they're not going to qualify. But it's my belief, through my experience in HR, that these are the exact people in your organization, and if they're highly compensated, they are probably pretty valuable to you. These are exactly the type of people that will want nothing to do with an exchange program and will demand from employers that they keep their benefit plans. And so you're going to have a situation here where one classification of employees will absolutely want benefit plans, and the other half will actually be in a position to lose money if you do. Pardon me. And so this leads into what organizations should do now, my point of view. First, obviously, I think organizations need to review their plans, and I think seize this opportunity to create better strategies around their health plans, both in design and, I emphasize here, employee communication. Obviously, everyone needs to move forward with implementing and complying with the Affordable Care Act because major portions of it obviously take effect on January 1, 2014. And for anybody that thinks that's still a long time away, it's not. You need to think about it in terms of your health plan. This is one or maybe two renewals away at the most. And there are other provisions that take effect later this year and into 2013. I think there needs to be a various or not to offer a plan. If you offer a plan, you're absolutely going to need to perform qualitative analysis to see whether it makes sense to remain grandfathered. And granted, I understand there are very, very, very few companies out there that are still grandfathered, but there are some, and it's very important for them to stay so. So there's analysis that has to be run into that to see how you go against those provisions. You definitely need to perform a qualitative analysis to determine if existing plans meet eligibility and affordability standards. Now, if you are in fully insured plans, then the plan provider for this is going to conduct a lot of that analysis themselves. But they will probably do so more in the terms of their interest rather than your own. Obviously, if you're self-insured, your TPA may do that, they may not. But in any event, you're going to need solid information on that. And that's so you avoid penalties. You don't want to walk into these penalties you wouldn't otherwise have to. And you want to be sure that health plans meet both standards. Unless, of course, you look at the subsidy situation and think from an employee valuation standpoint that maybe having an affordable health plan isn't the right way to go. Again, I think we need to think through the implications of the tax code, and employees may actually be better off not having an affordable health plan available at their employer so that they qualify for the subsidies. Again, I believe this is counterintuitive to what the government wanted, but to me, the table I illustrated before is very clear on this. I simply fully expect employees to figure this out, workers to figure this out, and they may well be not regarding it as any favor to them to have an affordable health plan in the company. you need to figure out the true organizational cost of not offering this coverage. It's not a no-brainer, as I said, that it appears. Most importantly, anyone out there that assumes that the $2,000 penalty will remain at that level, I believe, is incorrect. We all have to remember that from the very beginning, the only way that the health care plan was affordable was if two things happened. First, that every employer who had a plan would keep it, and every employee who was on an employer plan would stay on it. There was zero intention by the government from an affordability standpoint to have anybody who's currently insured move into the exchange. The countervail to that was that all states were going to expand their Medicare rules, Medicaid rather, to allow a host of lower compensated workers to move into benefit coverage. So those two things had to happen. Therefore, if in the early going that there is any wholesale abandonment or abandonment of health plans by a whole sector, then I fully expect the Secretary of Health and Human Services to step in. He will continue to rise until they have achieve the equilibrium that they are after. So it is not a no-brainer. And please remember, the $2,000 penalty is not deductible. So the costs currently paid for the health and welfare plans at companies are tax deductible. The $2,000 penalty is not. I think we should also be prepared that workforces losing employer insurance are most likely to put wage pressure on those employers. We have to remember, we, especially in HR, have been saying for years, because it has been true, wage increases have been suppressed because medical inflation has been wildly outpacing everything else. And so if you want to know where your raise went, well, the health plan paid it. All of that was true. Those were true statements. Therefore, I believe we can reasonably expect employees to then turn around and say, okay, well, if you don't have the health plan costs, then I want the pay increase. And HR practitioners need to think that through in terms of the implication of workforce management. If employers increase salary to offset health insurance, they will indeed have a higher FICA match. So currently that isn't on the table in the current construct. The employee decisions. There are going to be challenges that workers will face losing coverage in the event that an employer declines to continue to offer health insurance, right? Because they're going to have to go to exchange. Well, there's not a lot known about these yet, other than, of course, they'll be told about the exchanges for the subsidy if they qualify for that. And another thing that's changed is they will be purchasing coverage at their current age, which is likely to be a big change for employees in their late 40s and older. These kinds of things are mitigated and washed out primarily in group plans. It's going to be a different world, for employee decisions otherwise. The decision-making process is unlikely to be as easy as advertised. The government, to my understanding right now, is going to do the very best they can to make this web-enabled, to make these selections that way. But we in HR know in the times of great changes, especially in things that touch employees' lives so sensitively, tons and tons of questions. And HR practitioners and HR units are going to have to be prepared to help employees navigate those things. We cannot, I don't believe it's going to be possible for business to look its workers in the face and say, well, that's a government plan, so you're on your own, figure it out. I do not think that will do anything for workforce relations. We have spent better part of the last 50 years in instilling in workforces the idea that HR practitioners and units and businesses like JA Benefits that support them are the benefits experts. And a simple change in the law is not going to change 45 plus years of conditioning in that regard. They will expect us to know, they will expect us to help, and I think you are setting yourselves up for poor workforce relations if you simply shunt those questions to the side. So with that, I want to turn this over to Doug Johnson, and he's going to handle the additional topics for discussion that you see here.
Thanks, Chris, and thank you, everyone, for attending today. I'm going to talk through just some other topics that we'll have to deal with the Affordable Care Act. We'll go through current compliance issues, some other looming issues, what's coming down the road for you, along with implications for both small group and what we expect to happen there, large group implications, and then also some qualitative analysis and maybe some ideas on how to position your organization. And as Chris said, and I will continue to find as we dig through the legislation and its impact, is this decision will be very unique to each individual organization. I don't think anyone should be making blanket statements or even considerations about whether to keep a plan or not keep a plan without really doing some in-depth analysis and what effect that might have on your organization and your workforce. So keep that in mind, and I'll reiterate that again at the end of the presentation, but I really think that this is something that's going to take a much more in-depth look than maybe just looking at that $2,000 penalty issue. So let's talk about current compliance issues. Right now, we've got a couple things we've got to deal with. Right now, the MLR rebates, the medical loss ratio rebates have been issued. In Indiana, I think the only carrier that had to provide those was Anthem. So if you're a small group or a group under 100 there, those rebates have been issued. We did have some employers with United Healthcare in other states that did do some things differently. In Indiana, Anthem sent the rebate check for the group to the actual employer, and then you as employers have been called upon to divide that up. In other states, United Healthcare, where they did owe a rebate, actually sent the rebate checks to the employees, which is quite interesting, but it was one of the options that they had to do, so they sent the money directly to employees. Fortunately, here in Indiana, we didn't have to deal with that, so we'll talk a little bit more about that as well. Preventive care requirements for women began August the 1st. The next big thing coming down the road is the summary of benefits requirements, which began on plan years beginning after September the 23rd. And then also reporting the value of the employer-provided health insurance, which is required for W-2s to be issued in 2012. So for the medical loss ratio rebates, I mentioned this already, but it applied to fully insured plans only. The carrier calculation was based on calendar years starting in 2011. And it said that the Anthem checks are already out. It could be done either to policyholder. That rebate can be issued in the form of a premium credit or a check. And sometimes the cleanest way we found to handle those is a check directly to the employee. But again, speak with your representative here at J Benefits. We can work through those issues with you and help you provide some quick calculations on how to divide that check up appropriately. A couple other things to note there. We did have this question come in: how do you chase down former participants? It's not necessarily required. We've somewhat been given the free and clear on that. However, the IRS has not issued any guidance yet on that. ERISA plans, if you are an ERISA plan, can hold rebate funds in trust for the betterment of the plan. And the other thing of note is rebates are taxable to employees if the premiums were paid with pre-tax dollars. And that was issued by the IRS back in April. We got some guidance on that. The Women's Preventive Care Act essentially is effective August the 1st, and it broadened the definition for preventive care for women, including HPV testing, annual counseling and screenings, FDA-approved contraceptives, sterilization procedures and counseling, lactation support and equipment rental, screening and counseling for domestic violence, and at least one well-known preventive visit annually. There was an exception that has been granted for religious organizations, and they have until August the 1st of 2013 to apply. Now, if your plan does happen to be grandfathered, you'll need not comply unless you've adopted the initial set of preventive rules. And we'll come back and talk a little bit more about grandfathered plans in a little bit. The summary benefits requirement, this is the one that's coming up September the 23rd. It does apply to all plans, including grandfathered plans and self-funded plans. So this covers basically everyone. And all insurers and self-funded employers will have to get people who apply. Now, notice we said who apply for or enroll in individual or employer-sponsored coverage, a standardized summary of benefits and coverage that includes this 4-page coverage summary, coverage terms glossary, coverage examples of 2 medical scenarios, and customer service and website info. If you're fully insured and with one of the major carriers, the carriers are providing the summary of benefit communication for you. That one seems to be pretty standard across the board with all carriers, so you should be seeing those come out here to you shortly. One other note there at the bottom, HIPAA-exempt benefit plans, standalone dental, specific diseases do not have to comply. So one of the things that we did define earlier is if your dental plan is embedded in your medical plan, it does need to be part of the summary of benefit communication. But if you have standalone dental or if the dental can be purchased separately from the medical, then you do not have to include that in your summary of benefits. So quite a few little pieces of the puzzle there. Again, as we move along, we continue to get new guidance on all of these issues. W-2 reporting, employers would be required to include the value of the group health plan coverage on W-2s issued after 1/1/2013, which means for this tax year, when you issue your W-2s next year for 2012, you will have to report. The new reporting requirements don't change the tax treatment of employer-provided coverage. There is a small employer exemption if you issue fewer than 250 W-2 forms in the preceding calendar year. You are exempt from the reporting requirement. So it's not the total number of employees, but the total number for forms W-2. So that's your key point there. And it applies to all employers who provide applicable employer-sponsored coverage. What to report? Essentially, again, most of your fully insured carriers are going to provide this for you, but the value of all applicable employer-sponsored coverage, generally group health plans, major medical plans, mini-med. If you have a separate medical claim, if it's paid for separate of the premium, you would have to include those costs in there as well. Medicare supplement coverage, also healthcare FSA contributions if they're employer paid. Now, I said if they're employer paid, not employee money, but employer money, but a normal premium amount. How do you determine aggregate cost? Generally, you're probably going to use your COBRA premiums for aggregate cost and include pre-tax and post-tax coverage. Include both the employer and employee contributions, and employer premium contributions or employee cafeteria plan contributions. Employee that's been covered for 6 months, you'll probably have to show 6/12 of the value of that coverage on their W-2. So for whatever month that individual is covered in the year would be the appropriate value of the W-2 amount. Other looming issues we've got to deal with. Essential benefits. When I say metal levels, you probably have heard of bronze, silver, gold, and platinum plans. Those are what we refer to as metal levels. We'll be learning more about essential benefits. We're anticipating some release this month from the Department of Health and Human Services on details on that. There'll be a minimum value calculations for larger plans, valuation calculations for consumer-driven health plans, small employer deductible limits, market reforms including community rating, which I'll talk a little bit more about in a minute, employer mandates, out-of-pocket max limitations. One other note is a 90-day waiting period. I know some of you may have waiting periods that are longer than 90 days, but you will be required to move to a 90-day waiting period. That's the maximum you can use going forward in 2014. Other reporting requirements by the employer, and then how we deal with exchanges in each particular state that we work in. So those are just some of the other big issues that are on the table for us. Let me direct now specifically speak to impact of healthcare reform for small employers. And when I talk about the MLR rate implications there, I think that's what I want to focus on quickly for you. Under the Patient Protection and Affordable Care Act, medical loss ratio impacts, which we talked a little bit about already, but there are targets that in the large group market, 85% of premium has to be devoted to claims. In the small group market, it's 80% of premium. And so those are the targets, if you will, that the insurance carriers must meet. And again, your ratio is basically your ratio of claims divided by premium, and you've also got to deal with federal and state taxes, medical management expenses, other quality improvements, credibility adjustments, and ultimately based on 3 years of combined experience. So it's not a simple calculation. I would grant you that, but that's what the insurance carriers are actually having to deal with in terms of complying. Let me also jump and talk about current factors to manage risk, because if you're in the small group market, you probably understand today that you're medically underwritten. And today, insurers out there can base your rate on demographics, which is your age and gender mix, your family composition, your geographic area, tobacco use in some markets, group size, industry, health underwriting or experience rating, and the purpose is basically to match the rate to the risk and minimize adverse selection. So that's really what is available to insurers today. Going forward, managing risk for insurance companies in that market is going to look a lot different because we're moving to what we call adjusted community rating. So it means there's no health underwriting, by age, but the age is limited to a 3-to-1 maximum change status, whereas normally you would see a 7-to-1 or 8-to-1 range limit there, range for that age. Right now, we can only go to 3-to-1. Family status, and then also smoking status, but you can only rate up 1.5 times for smoking status. So this is going to change your calculations quite a little bit. So what we did is we pulled an example together, and I think this came from one of the large insurers that does business here in the state. We basically said, if we looked at a group today and the base cost for your benefits were $250, on the left-hand side, you see all the adjustments that are made for underwriting rates. You got age, gender, we gave a little discount for that, family composition, area, tobacco use, counting, they got a 5% discount for that. They're fairly healthy, so they got a 35% discount for that. And the administrative retention this year is still, 0.8. If you do that, basically you come up with an adjustment there, and the rate for that individual would be $156.98. Going forward, when you take out a lot of the things that you can do in terms of underwriting, look what happens to your premiums. They're 201% higher than they would have been otherwise. So this is some of the impact we may see on small groups going forward, especially if you happen to be healthy and are in a very favorable industry. What we're hearing today is that 45% of Anthem's Indiana small groups will see an adjustment of somewhere between 14 to 35% simply from the removal of the risk adjustment factor for actual medical risk in the group. And overall, 65% of their membership will see an increase from this factor. So they're looking at other expanded alternative funding methods, and we're going to see where that takes us. But suffice to say, there's a real good chance if you're a small group in Indiana right now and you're fairly healthy, you're probably going to see a pretty good premium increase in 2014 just to go to this modified community rating program. On large employers, a little different story here. You've got more options. You're going to wonder, do you keep your health plan? What happens if you don't? If you have a health plan, it's probably business as usual, but you're going to have more reporting requirements. For non-qualified health plans, you could end up with a $3,000 per person penalty for somebody who drops a qualified health plan and then gets a subsidy through the exchange. And this is what Chris was talking about earlier, where we somewhat anticipate employees being subsidized very significantly at certain income levels to go to the exchange. Well, this is an issue that we're going to be talking with you about, and that's what kind of plans do we design to best suit you and your organization. In addition to that, if you currently drop your plan, you get this $2,000 penalty issue. You do get the first 30 free, but remember that penalty is not set in stone. You lose your tax deductions on that. There's probably additional reporting requirements as well there. And again, we don't think that $2,000 penalty is going to hold. A couple other things, in 2014, no pre-existing condition on any member can be had out there, so that'll happen in 2014 as well. And then this whole grandfathering issue, and I'll talk just a second about that, but what we've been finding is the majority of our plans out there are probably not grandfathered at the moment, or if they are grandfathered today, we anticipate that they won't be grandfathered down the road once a collective bargaining agreement is done or basically renegotiated. So there are a few left out there today. Essentially, if you are grandfathered, you are exempt from a lot of the things we're talking about, and you will be exempt as long as you stay grandfathered. But frankly, we don't know that many of our employer clients are going to be able to stay that. But I think that's something, if you have a question about, contact me individually. I'll be happy to walk you through that scenario. Chris was mentioning earlier, too, some of the other things to think about. I threw a couple slides in here maybe for practicality that might make sense. This is sort of an illustration of costs for a family of four. This is for Milliman's medical index this year. Roughly total cost is about $17,258 for a family of four. and that's split up today between an employer contribution of about $12,144 and an employee contribution of almost a little over $5,114. So that's what we might say, okay, that's a lot of money. This $12,000 I'm spending, that penalty would be a lot less expensive at $2,000 for me to do that. And it's true, it would initially, but what we see is the following. When you start talking about whether or not you maintain a plan, you're probably going to have an employee come back to you and say, well, wait a minute, if I'm over these income levels that are going to be heavily subsidized, they're going to ask you for salary adjustments. And in this case, that $12,000 and some odd dollars that you're paying for their health plan today, they want that money back so they can go purchase health coverage and $14,500. Now, whether or not you agree to give all that money back or not, something else, but that's what it's going to take for them to be whole. In addition to that, you'll pick up another $1,109 in employer payroll taxes. You've got a $2,000 excise tax or penalty, and then that penalty is not deductible, so you've got another $400 potentially of tax there. So all of a sudden, you're up to $18,009 for the future if you don't have a plan, when today you're spending only $12,000. Yeah, and understand what's going to happen with your particular employee organization, your group, as you begin to look through some of these decision tools. As we move forward, we'll also be looking at sort of the qualitative side of things. We're going to want to look at your existing plans and see if they meet qualifying and affordability standards, which plans are subject to PPACA, the 60% actuarial value piece, and for benefit CFO clients with Milliman. Please note that we'll be doing those actuarial values for you, and we've been doing those for several years, so it's really sort of old hat for us on these actuarial value pieces. But we'll be working through those calculations with you to determine the value of your health plans. In addition to that, we'll be looking at this premium co-share, this 9.5% limit for employees coverage. It's basically your share or the employee's share of W-2 Box 1 income, and that's the maximum contribution for the affordability piece. But we'll be looking at plan designs, and if you keep a plan, that will be one of the pieces of the puzzle we will look at. One thing I did want to leave you with today before you got out of here is if you're needing us to perform some kind of an analysis for you, is I wanted you to have a takeaway to know essentially what kind of data we're going to need to do some of the. This list looks long. It's really a census that most of you are familiar with. However, it is one of those pieces of the puzzle that there's a lot more to this census data request than maybe you've seen in the past, because we will have to have, W-4 information, W-4 Box 5, allowances, hours worked, gross income, taxable income, a lot of things that may be over and above what we currently would have asked for today. But this is the data set that we need to run analysis, and whether we're doing this with Milliman or we're doing it with one of our other calculator tools that we have, this is the kind of information you're going to need to pull together for us to run that analysis. So again, I wanted to get this out to you as well. And if at the end here you'd like a copy of this presentation, we'll post that out on our website, but I can also email this directly to you as well, and a link for a copy of what we've done today. We could probably open it up to some questions. I'm going to unmute everybody here, and if you've got a question, please jump right in. Bear with me a second here while I try to get everybody unmuted.
Okay, do we have whoops, somebody has some hold. Do we have any questions?
Something's going on. That's it.
Seems like we have quite a bit of feedback on the line as well. So what we'll do is I'm going to jump to the next slide. And if you do have questions, we'll go ahead and put this slide up as well. And if you would, feel free to email either Chris or I. We'll be happy to take care of those. I know we did have one question come in during the presentation today about the 30-hour threshold. The 30-hour threshold, there's several ways to meet that calculation, and so consequently we'll send you the details on that as well. If any of you as well need that, if you shoot Chris or I an email, we'll get that back out to you as well. Again, we'll have a link to this available for any of you that would desire this as well.
And as I said, anyone that wanted to get a copy of the report by Dr. Ramage in his capacity as working for the tax policy department in Treasury, please send me an email. I'll tell you too, in that report, he also goes into pretty decent length about the 30-hour threshold for tax. So if anybody would like a copy of the report, just email me and I'll send you the information to download it. Okay, do we have any other questions?
Anything come up? Would like to thank all of you for attending today, and again, be sure to contact Chris or I with any particular individual questions you've got.
My guess is,
and obviously we'll have a lot more information as things continue to develop with this whole process. Thank you, everyone.
right.